So I'll just start by saying hi to everybody, and first of all, hi to Gil, Aram, and Mark, who are the research task force of the ETCMA, and doing amazing work in all levels. I think there is a few main focuses as far, and I can say even vision, as far as research task force goes for the ETCMA. One is to bring research closer to whoever is interested and to enlarge the group that are on the front of research and bringing the research part of Chinese medicine. The second one is to get us more acquainted with research, with the current research, and use research also for our advocacy and promoting our medicine. As you will hear today, there is much more. I can say whenever I'm looking at the research task force webinar, I'm always surprised on how much research there is, and I haven't discovered, and I'm quite active in reading research. So I think everybody is like this. So it's a good opportunity to know how much research is, to understand better research, know how to use it, and hopefully also to get inspired to be involved in research. As some of the task force was focused also on how to make everyone a researcher, like making the possibility of putting up cases from clinic and making them into a publication. And this is how our profession will grow. And definitely the more we will collaborate and on every level, and definitely on the level of research, the strongest our stand will be in any possible frontier, So I think this is one of the core issues is really of this task force. And I'm personally very thankful to Gil, Aram, and Mark, who are working extremely hard behind the screen to bring this quality work and this webinars. So just lastly, and I'll pass it to Aram. Yesterday was the 16th of November, a day to remember. If you don't have a birthday, that's the birthday of acupuncture. Not the real, but the birthday of Aram will explain why this day is chosen and is celebrated worldwide. And it's going to be a major event worldwide, very much because of Aram's kind of perseverance and high quality of delivery content around acupuncture and making acupuncture viral and amazing. Last year it was "I do acupuncture" as a slogan. This year acupuncture works, and maybe in the end Aram will reveal what will be next year's theme. But Aram, from here it's you, and I just again wanted to thank everybody for coming and for you for putting up this amazing webinar. And unfortunately I have some other meetings, so I would say goodbye and thank you. I'll stay for 2 minutes.
Thank you. Thank you, Yair. Thank you, Dr. Yair, for your time and for your leadership. I appreciate it. We all appreciate it. But I also want to thank every single one of you who are attending this meeting. It is wonderful to see so many, square boxes. Ideally, we love face-to-faces and in person, but we have to deal with time zones and the distances. But I do want to extend a heartfelt thanks for everyone who took the time and participated. I know that we're in many time zones, so I do want to express that as well. We're going to try to keep this presentation short, but also provide as much information as possible. Always bear in mind that any information that is presented here will be recorded and will be available on our YouTube channel. So at any time you want to review any of the messages or access the video recordings, they're available to you. The YouTube channel for ETCMA. And all of the content that is going to be presented, the slides, the PowerPoint presentations, etc., are available to you for download as our members, and you'll be more than welcome to use them. They're made for you. So as we present the material, If you like something, shout out. It'll be available to you at no cost, or just it's our part of doing our job of providing the tools you need to help promote our profession, our proud profession. So without ado delays, let me share my screen. And first and foremost, start by real quickly giving you an introduction to who we are. The research task force initially was formed in the summer of last year with the objective and the goal of providing the tools and the necessary components you need to be effective at the job, and that is to bring research closer to our practitioners by providing tools, methodologies, and components that you can do, that you can integrate into your practice, such as you're going to see today, like research studies or analysis or summaries of what research is available, interpreting research, etc. Our team is a small, nimble team. Mark and Gil and I have been really working in the backgrounds to try to get things done. Anya, I'm sorry, couldn't join us today. But you can notice that we have this perfectly nice round logo reserved for you. If any one of you has research background or is interested in research, we would love to have you as part of our team. There's a lot of really good opportunities and great plans for our future. And we want to grow this to become a global team that we can really produce some good quality results. What we do is a quarterly newsletter and a quarterly webinar. And these are broken down into 2 research-related topics and 2 condition-related topics. So they'll alternate, but we'll pick one specific condition. In the summer, it was cardiovascular diseases. Right now, we're doing the cerebrovascular diseases, stroke. And then we will do 2 research-related topics. The first of this year was case reporting, how to use proper case reporting tools and put together good, admittable and publishable case reports. And then I believe the spring newsletter or the fall newsletter, sorry, the winter newsletter and the winter webinar, which is going to be in 2 months or 2 to 3 months, will be on cost effectiveness. So we'll be able to demonstrate and provide you research information on the cost effectiveness of acupuncture in clinical settings. All right. But enough about the group. What I'd like to do now is share with you, if I can stop this, the promo video. Some of you may have seen this, but I wanted to share this because I think it really demonstrates the global effort that we've put together to promote our proud profession. And I want everyone to have an opportunity to see this and share. Let's make this truly viral.
I do acupuncture.
I do acupuncture.
I do acupuncture. It works.
Ik beoefen acupunctuur.
Eu faço acupuntura.
Eu também.
Ich behandle mit Akupunktur.
I do acupuncture.
I do acupuncture.
גם אני עושה דיקור סיני.
I do acupuncture.
我是针灸师。
We practice acupuncture. Our 21,000 NCCM board certified acupuncturists do acupuncture.
Today is a very special day. The European Traditional Chinese Medicine Association, ETCMA, would like to invite you to celebrate and commemorate World Acupuncture Awareness Day. It was in November of 2010 that UNESCO inscribed acupuncture and moxibustion into the annals of intangible cultural heritage of humanity. What does that mean? It means that acupuncture and moxibustion, essential key components of a vast anthroposophic medical discipline that has been practiced for thousands of years, has been accepted as part of human culture's treasure. Not of one country, not of one region, but for the entire human species. As medicine evolves from disease-centric to patient-centric to individualized medicine, this heritage is again and again demonstrating its vital contributions as part of an integrated medical approach to address human health and wellness. So today, we call upon all of you who practice acupuncture and traditional Chinese medicine to again, united in one voice, commemorate and celebrate our proud profession. Thank you.
Acupuncture works, and it has been recognized in practice in 183 countries around the world.
Acupuncture works and it helps with my anxiety.
Acupuncture works. It's great for back pain. Acupuncture works and it helped me with my migraines.
Acupuncture works and it helps with pain and inflammation.
Acupuncture works. It's even safe during pregnancy.
Acupuncture works. I use it for stress and for my wrinkles in my face.
Acupuncture works as a comprehensive holistic medicine that is recognized and practiced in over 183 countries all over the world.
Acupuncture works. It's safe and it's been proven scientifically.
Grazie al mio acupuntore che mi ha aiutato tantissimo con il male del mio ginocchio. Grazie ancora, grazie.
Acupuncture works. Patient feedback, confirmed by scientific evidence, has shown that acupuncture is an effective drug-free treatment for a variety of pain conditions.
En in 2015 is bij mij uitgezaaide borstkanker geconstateerd. Voor mij is acupunctuur een waardevolle aanvulling, omdat het de kwaliteit van leven gewoon echt verbetert. Het zijn die kleine dingetjes, al die kleine dingetjes die het zo zwaar maken, dat je ook zo lang de medicatie krijgt. En door de acupunctuur is dit duidelijk verbeterd. Dus voor mij werkt het echt heel goed.
Acupuncturists help people with a range of conditions, from the treatment management of pain to those suffering from depression. Today, we are raising awareness of our wonderful profession and the positive impact acupuncture has in people's lives, our role and our professionality in health and care around the world.
Okay. Thank you for the patience. Okay, so what we'd like to do is talk about stroke. So today's topic is stroke. And what we'll do, the agenda will be, I'll present a small infographic that we've made for you. And again, this infographic is for you. It's available, download it, use it. You want to clip certain parts of it, use it for your advertisements, use it in your clinic, use it as a tool to promote acupuncture within a clinical setting. If you're working with, collaborating with other MDs or collaborating in situations where you want to present how acupuncture can be beneficial for stroke rehabilitation, there will be some important tools here in this infographic for you. And then we're going to switch over and Gil will present a very specific research article that deals with Bell's palsy and stroke. And then Mark is going to do a research summary, which will review and present a variety of research topics and the statistics that he's culminated in a summary. And again, that summary is also available for you. And then I'm going to present at the end a very unique case study, a case report, which I've personally been involved in. And I think you'll find it interesting. So subsequently, afterwards, we will have an open session. So if you have any questions, please reserve them to the end. And let's begin. So, stroke. It is the second leading cause of death after cardiovascular disorders and affects about 9 million inhabitants just in Europe alone, right? And there's about 1 million deaths each year due to stroke in Europe, in European Union. It's the leading cause of long-term disability, and roughly calculated about 160 million years of healthy life are lost due to stroke. And stroke is not racist. It's not discriminated. It can strike anyone, any age, any gender, any ethnicity, cultural, etc. So these are some very important key points epidemiologically that you can use to open the discussion, right? Interestingly enough, counterintuitively, you would think that males would be higher risk of death from stroke, but in Europe, females are at a higher risk of death from stroke than males. And we're very familiar with the various risk factors involved in increasing the chances of suffering from stroke, hypertension being the silent killer, if you will. And, just as a sideline, I'm in Nepal right now with a group of acupuncturists providing a free clinic, healthcare center for rural Nepal. And I'll tell you, epidemiologically, 70% of individuals that I've been treating have hypertension that is untreated. So education plays a very important role in addressing this, right? Because hypertension tends to often go untreated. Inactivity, diet, you have the cholesterol elements, and then you also have alcohol and smoking, heredity, gender. These are all elements and components that play a role in increasing one's risk factors for stroke. Now, the burden of stroke in terms of cost is substantial. About $45 billion a year is spent, according to at least a study in 2015. It might be even higher now. On stroke rehabilitation and stroke-related costs in terms of the healthcare costs of European Union, right? About 20 billion of that is spent on direct care for stroke rehabilitation and stroke-related care. And then the variety of other costs and secondary costs associated with it also play a big role. And this is an area where we can provide a reduction in cost and be more cost effective in terms of the rehabilitation, as you'll see during the presentations. So the classification of strokes that are prominent right now, about 68% of the strokes are considered ischemic strokes. About 15 and 16, roughly equal, are hemorrhagic and transient ischemic attacks. And we'll take a quick look at what each of these represent truly. But the foundations of stroke from a pathological pathogenesis perspective is either a blockage or a hemorrhage rupture of an artery or an arteriole that supplies blood to some portion of the brain. If you're suffering from an ischemic or a transient ischemic stroke, there is no rupture, so there's no bleeding. It's simply an aneurysm or a pressure or a block that prevents perfusion of the tissues downstream to the vessel, and therefore causing necrosis of the tissue. In TIAs, sudden acute self-resolving TIAs, which is presenting with similar symptoms as a stroke, the regeneration of the tissue via angiogenesis and new neuronal recruitment is rapid. So the risk for long-term disability is greatly reduced. The most serious, of course, is the hemorrhagic stroke, which ends up leaving substantial damage to the cranial tissues and to the nerve tissues, and requires a much longer time in rehabilitation. Now, one very important thing that we always want to stress is to recognize the symptoms. And in a clinical setting, if you're seeing any of these, you need to be very fast in responding, right? It's FAST. Any facial alterations or paralysis of the facial muscles could lead to drooping or shifting of the ties. We all practitioners ask to check the tongue. If you see deviation of the tongues, be aware that there may be either a history or a potential occurrence of a stroke. Arm weakness or limb weakness, speech difficulties, slurring speech, etc. And that really means time is of the essence. As a practitioner, as a healthcare practitioner, we need to be cognizant of this because we may save a life, right? So when is the ideal time for implementing acupuncture as a modality in stroke rehabilitation? If you look at the definition of a stroke timeline, from the time the stroke occurs, the hyperacute, acute stages, these are often addressed in hospital care settings. And in some countries, including China, acupuncture begins at that stage, right? Even as in some hospitals in Sichuan and in Chengdu, I practiced hyperacute stage acupuncture modalities in the stroke timeline. However, in most Western cultures, we tend to see in the chronic stage, we tend to see patients visiting us for acupuncture treatments for stroke rehab in the chronic stage. Unfortunately, it's either through anecdotal or even research data shows, and my personal experience actually shows that the sooner you engage in acupuncture or include acupuncture in the rehabilitation protocols in this timeline, the better the odds of recovery. So, ideally, you want to be within the acute to subacute stages when you begin the implementation of acupuncture or electroacupuncture in the rehabilitation phases. And this is important. And this, in terms of the evidence available right now, and you'll get a lot more of it from Mark's presentation, but I've just kind of summarized a little bit in synopsis of it here. I'm not going to read every single one of them, but some of them are very poignant, right? Stroke is one of the most common conditions treated by acupuncture in China, right? And acupuncture could help stroke patients by alleviating oxidative stress. Is another important stress from the Journal of Neurological Journal. Acupuncture is recommended by the World Health Organization as an alternative and complementary strategy for stroke treatments, right? And in addition, I think a lot of the clinical guidelines by many countries have admitted and integrated acupuncture as a potential adjunct therapy in stroke rehabilitation, right? So these are some of the synapses that I've included in the stroke infographic for you. It's available. You can download it, use it, advertise it, however you want to go forward with it. So the key of these infographics, just going forward, we have already a substantial amount of them in our library, and we're building more. And as our research task force grows, we'll be putting more and more of these infographics out for you to help your job in communicating to your patients, to your partners, to your colleagues in different fields, and to also help you lobby and inform the general public about our profession. And this is one of the reasons why we, as an RTF, provide a supply to your demand, right, and the needs. So that concludes the small presentation on the infographic. More will be available as we move forward. I think what I'm going to do now is disconnect my share screen and allow my colleague Gil to resume the presentation. Where's my stop share? There it is. Gil, you're up, my friend.
Okay. Thank you, Aram. Can you hear me well?
Yes.
Okay, let me fix this screen. Can you see my screen as well?
Yes.
Okay. Okay, hello everyone. Thank you for joining Research Task Force webinar. First, thank you very much, Dr. Akopian, for your great presentation and for your great work regarding Acupuncture Day, November 16th. It was quite, I had chills a bit while seeing the video. My name is Gil Ton, and today I will present research entitled Acupuncture in Chinese Herbal Medicine, Reduce the Risk of Stroke in Bell's Palsy Patients, a population-based study. Obviously, we are very, very limited in time. I'll talk about 10 to 12 minutes. I will briefly introduce facial paralysis and the association between Bell's palsy and stroke. And last, I will share with you the study design and the findings of this study. This study was published by myself and other colleagues and co-authors in 2019. It was part of my PhD studies in Taiwan. I was focused mainly on Bell's palsy patients. I conducted a double-blind randomized controlled trial using laser acupuncture. But as a side research project, we conducted this study. So if you are interested more about this topic, you can download the paper from either PubMed or the Journal of Alternative and Complementary Medicine. So facial paralysis, actually, the causes and etiologies are quite varied. Tumors along the pathway of the facial nerve can cause facial paralysis. Iatrogenic factors like TMJ surgery as well can cause the palsy. Certain types of viruses like varicocele zoster virus causing a more difficult treat palsy named Ramsay-Hunt syndrome. Trauma due to car accidents or any kind of trauma to the temporal bone causing fractures may lead to facial paralysis. Let me use my laser pen as well. I think it will be useful. Central tap facial paralysis caused by stroke as well. It's one etiology of facial paralysis. And after we exclude all of those risk factors, the idiopathic facial paralysis, known to be called Bell's palsy, is also one of the causes for facial paralysis. Actually, it's the most common one. So in terms of etiology specifically for Bell's palsy, although it's the most common one, it's unknown. There's a lot of debate about the mechanism of how this paralysis occur. But viral infection, which cause inflammation in the inflammation and edema in the bony fallopian canal, is the most widely accepted mechanism. In terms of epidemiology, as I said, this type of paralysis is the most common one. The incidence varies between different populations in the world, but in general, between 11 to 53 cases per 100,000 cases are, these are the numbers. It's not very common, but we see thousands or 10,000 of them each year, okay? Basically, there is no, the genders are equally affected. There is no big differences between men and female. And the disease may happen at any age, but the median age is about 40 years old. Chinese medicine, as you all know, if any of you have lived or visit China or Taiwan or other Asian countries, you can see a lot of Bell's palsy cases, facial paralysis cases in the acupuncture departments. It's very, very used. Also in Western countries. This is a report of the WHO in 2003. The report or review and analysis on controlled clinical trials of acupuncture. So as you can see in the first part of the review, facial pain was included. The second part, Bell's palsy was included. So the literature is quite full with research and articles about this topic. Now you may ask yourself, so why is he talking about stroke? What's the connection between Bell's palsy and stroke? And that's a very fair question. And as we all know, and you all know, I don't telling you anything new. Stroke is a very complex disease. Heterogeneous is a disease. There are many, many risk factors and diseases that may lead to stroke. But recent years, there are more evidence and research that some kind of viral infections may start the process of inflammation in the body, which will lead to some certain blood diseases, blood vessels diseases. So when we are talking about ischemic stroke, specifically atherosclerosis and virus vasculopathy is very, very relevant. So the traditional risk factors for endothelial dysfunction in the blood vessels are LDL, elevated and modified cholesterol, free radicals due to smoking, and hypertension and diabetes. This is all known. However, as I mentioned, there are some infection microorganisms of specifically herpes viruses family that have been associated to the increased risk of stroke. Okay, and for the starting process of inflammation in the blood vessels. So this study was published in Taiwanese population, and they measured the incidence of stroke in the general population, and they found association between Bell's palsy and stroke. Later on, this paper was published in the European Journal of Neurology. In the Taiwanese population as well, they found out there is increased risk of stroke in Bell's palsy patients. This study specifically as well, they had two cohorts. One was using oral steroids and one was without any oral steroids. And they found that when they are using patients who used oral steroids, they had a decreased risk to develop stroke. Now, we all know that steroids has a very strong, powerful anti-inflammatory effect. And we all know that acupuncture and Chinese herbal medicine has the same effect as well. So our study hypothesis was that we know there is some kind of association between Bell's palsy patients and stroke. And we know that we don't know what is the effect of TCM treatment modalities, specifically acupuncture and Chinese herbal medicine, in order to reduce that hazard in Bell's palsy patients. Previous studies showed that there is increased risk of stroke in Bell's palsy, and steroids may lower the risk. So therefore, our research question was, can TCM treatment modalities lower the risk of stroke in Bell's palsy patients? So the aim was to investigate this association and to see the effect of TCM in Bell's palsy patients and their risk to develop stroke. How did we do that? We obtained data from Taiwan's National Health Insurance Research Database, known as NHIRD. Okay, we collected data from the research database. So basically, this is a retrospective cohort study. And we compared the incidence of stroke. So the study design, we followed the patients for 13 years. And the population were patients, adults older than 18 years old, with at least 2 ambulatory visits or 1 hospitalization with an ICD-9 code of Bell's palsy. We had 2 cohorts, Bell's palsy patients who use TCM, specifically acupuncture, Chinese herbal medicine, also traumatology. And the comparison cohort were patients without any use of TCM. The primary outcome was the appearance of stroke diagnosis, or we followed them for 13 years. It's either the 2 options. So this is the study flow chart. After we excluded many patients, for example, patients who had previously diagnosis with stroke, missing information, and all kinds of factors, we had 238 patients overall for the final analysis. And the results were quite interesting. Out of 238 patients who were included for the final analysis, 27 of them were not TCM users, and 5 of them were TCM users. So that result was significant. As well, in a subgroup analysis, we compare the incidence of stroke when the patients were used acupuncture or TCM with oral steroids together. So when the patient used only steroids, for example, 65 cases, 8 of them developed stroke. But when they used both TCM services and oral steroids, 67 cases, 2 of them only developed stroke. So the combination of integrative approach of Eastern medicine and Western medicine provided the best results. So our main findings for the study, it was the first investigation that shows the association in Taiwanese population between Bell's palsy and stroke. After we matched the two cohorts, we control all the comorbidities because obviously stroke is very heterogeneous disease. After we included many types of medications, the results showed that TCM users had significantly lower overall risk to develop stroke. And in a subgroup analysis, we found that this integrative approach of combining drugs and TCM services gave the best results. Now, this is a takeaway for you. These are the 10 most commonly used single herbs and compound formulas used by the TCM cohort. So, for example, the second most common one, Buyang Huang Wu Tang. This is a very famous formula, extensively investigated for its anti-inflammatory, antioxidation, and regulation of lipid metabolism. In TCM, it's mainly used for Wnt type of diseases. So it's used for stroke, but also it's used for Bell's palsy. There is a list of all the formulas that have been used by Bell's palsy patients for you, if you're interested as well. The 10 commonly single herbs, for example, jiangcan. It's a well-known animal product of Chinese herbal medicine, and it's very commonly researched and investigated for the wide spectrum pharmacological effect affecting the nervous system and has antioxidant effect as well. Mudan P is very commonly being investigated for its anti-inflammatory effect. So that was my part. Thank you very much for listening. And don't forget, our next webinar will be in January 10th about acupuncture cost effectiveness. So thank you for joining and for your listening. Mark?
Okay, I've unmuted myself. Hi, everyone. So am I able to...
Yeah, Gil, you must stop sharing.
Yeah.
Gil, we want to stop sharing, yeah. Don't hog the screen, boy.
Yeah.
Sorry.
Okay, here goes. Let's see if I can find my one. That looks like there. Yep. Good. I must admit at the outset that unlike the two previous speakers, I'm not an expert on stroke. So what's he doing here, you might say? Well, I'm talking about various research aspects of it. But I'm not an expert because I've got a general purpose acupuncture practice, and these sort of people don't beat a path to your door. Okay, I've been in practice 40 years now. I've probably seen about 5 stroke patients in that time. So certainly not an expert. I know that some acupuncture practitioners do see a lot of stroke patients, or a substantial number, and some are experts, and I recognize some are here in this audience today as well. But I think they're very much in the minority. If you look, and I try to extract some a figure on what are the proportion of people coming to acupuncture who are presenting with stroke symptoms, and it appeared to be something less than 0.25%. Okay, so we're talking about tiny numbers, and if you compare that with the situation in China, then it's enormously different. The most prevalent condition treated with acupuncture in hospitals. And when I was there, this was in up in Harbin in the TCM University and Hospital. A lot of the people that we saw going around the hospital were stroke patients. So I'm just going to change the view so that pictures of all of us and you aren't covering up some of my slides. Where's the view bit? Oh. Okay. So what's the reason for this? And I think there are a lot of different factors at play, and some of it is to do with cost and some of it is to do with access. But first, I'm going to have a look at how much recognition there is for acupuncture from the medical authorities. So, are there recommendations for acupuncture in national and international stroke guidelines? And this is some data that came from work that Stephen Birch primarily has done. He found 83 such guidelines. 48 of those included acupuncture and 35 didn't. But if you look at, so 43 made positive acupuncture recommendations. Okay, that looks good. It's about half of them. But how much stuff are they recommending acupuncture for? Now, stroke encompasses a lot of different symptoms and symptom areas. And all we've got at the moment is UK and Europe dysphagia, one thing. Germany, 3 things. In the NICE guidelines, doesn't appear at all. Wasn't even included in one of the things that they were going to look at in their review, let alone recommending it. So how are these sort of recommendations arrived at? Well, it's not just the effectiveness evidence, which is going to be mostly RCTs. They also have to take into account safety. Okay, we know that acupuncture is very safe, so that's a tick for us. Cost effectiveness, there's very little cost effectiveness data in respect of acupuncture and stroke. And also patient preferences, and there's very little data about this as well. There were some surveys done, published in 2020 by Nikki Robinson, and it showed that stroke patients may be interested. Generally, they don't know anything about acupuncture. It's just not on their radar. And a similar sort of thing goes for conventional stroke professionals. The lack of knowledge about acupuncture was the main obstacle for them recommending it and referring people. So what I've done is a sort of quick and dirty summary of the evidence, and it's something that any of you could do if you had a few hours to sit down and go through a database. I just use one database here, PubMed, which is freely available. And I looked just at the last 3 years because there was an updated guideline on stroke from the British Acupuncture Council in 2019. So I've just looked at the data since then. And I've only looked at systematic reviews. So SRs here is systematic reviews. And they provide you with a sort of easy to see summary of lots and lots of evidence in terms of individual trials that otherwise it would take you a long time to get to grips with. So and I've split up the data here into the systematic reviews into the ones that are looking at overall sort of general rehab, as opposed to the ones that are focusing on a specific symptom. And it's a somewhat arbitrary distinction. So the 4 that are for overall rehab, they were mostly looking at outcomes in respect of dependency, motor function, and neurological function. And for all of these things, and in each of those 4 reviews, we find acupuncture was superior to controls. Now, one thing to note is that there weren't any sham comparisons done. They sort of blanked out any sham data from the systematic reviews. And the recommendations are not strong. They don't come to any firm conclusions. And this is due to the perceived poor quality of the trials. How does this come about? And what does that actually mean? And because we know that particularly if you're not using sham controls, you're not going to be blinding doing any blinding, or not of the patients anyway. So there's not going to be double blinding. So you're going to fall foul of the standard ways of assessing risk of bias and quality. So you're inevitably going to get downgraded to some extent. Obviously, if you do go in for sham controls, then you've got all the problems with the fact that they're not inert for acupuncture. So acupuncture's sort of in a difficult position in both of those respects. So how about the specific symptoms? Now here you can see there's a lot of data, more than 50 systematic reviews covering hundreds of controlled trials and thousands of patients. And there's a table there that shows, it just shows how many reviews there were. And this is just in the last 3 years in one database for each of those symptom areas. And acupuncture was beneficial in nearly all of those reviews. And for the most part, it's used not on its own, but with conventional treatments. Where it was compared on its own against medication, sometimes it was better, sometimes it was equal, but then it had fewer adverse events, so safer. And when it was combined with medication, it was better than medication alone in all of the analyses. And it compares well with other non-pharmacological treatments. Again, there's the issue about, and there are again very few sham controls used, and the quality issues again. And this one, trespassing somewhat on Gill's territory, but one of the systematic reviews that I came across, Wang 2022 from Taiwan, and it's these cohort studies again, and they're in such a good position with that National Health Insurance database to be able to look up this stuff with large numbers of people over a substantial period of time. So there's one group of these studies that are about, you take, for people who've had a stroke, if you look forward years, what's the likelihood that they get another stroke? Also, they've looked at what's the likelihood that they get things like heart attack, dementia, pneumonia, and a whole bunch of other illnesses. And turning it around, the other thing they did was to say, okay, what's the risk of stroke for people with other diseases? And Gil's talked you through the Bell's palsy one in detail. The diagram there is for the fibromyalgia one, and you can see quite clearly the dotted line at the bottom is the acupuncture cohort, how they've got a lower risk for likelihood of getting a future stroke right from almost the outset. Okay, so that was all the data on, if you like, research to do with external use. How about internally? And can we learn anything about how to practice acupuncture better from looking at this kind of research? And I know that research papers are not usually where acupuncturists look for practice information, and with good reason as well. They're naturally suspicious of it as not relating very closely to actually what they're doing in real life. Nevertheless, the RCT literature does hold a lot of clinical expertise, especially for something like stroke. And nearly all of the trials have been done in China. So I think if you can access it, there's a lot of information to be gleaned there. You'd have to ask, of course, is it relevant for the European situation, different geographically, different culturally? And it may well be that other sorts of research are more helpful. If you're looking to put together good practice for some stroke aspect, then some of these other types of research may be more helpful. So this is just me combing through the systematic reviews. I didn't look at these specifically to do this. I looked at them for the effectiveness evidence. So this was just stuff that was around and you could easily collect it in. And there are always studies that the Chinese in particular do comparing different sorts of acupuncture in respect of stroke, scalp acupuncture, better than body acupuncture. several reviews agreed on that. There were also single reviews that said that tongue acupuncture, warming, hot needle, electro, Gin's-3 needle, and a whole host of other different sorts of acupuncture, some of which I'd never heard of, were also better than body acupuncture, than standard acupuncture. And I think you have to be a bit slightly suspicious of these if they're all better. And I'm sure that the people who were doing them were maybe protagonists of that sort of acupuncture. There's always going to be information about what points are used that you can find in trials, and some of the reviews neatly package it for you. So what are the points that have been most used? And they give you lists of local points for particular sorts of stroke symptoms, and distal points and scalp points. And if you look at the distal points, they're nearly all the same bunch of points, very common ones. How many sessions is better, and also when to start treatment after the stroke. Referring back to what Aram was saying, and the information here was that if you start treatment within 2 days, that's best. If you can't do that, then within 2 to 15 days is pretty good. After that, it didn't much matter when you started. There wasn't an effect of that time interval on the effectiveness of your treatment. And I'm not saying that it doesn't work after that, because acupuncture was still better than controls at all of the different time intervals. Right, so that's some of the possibly helping you in practice information. And it's the sort of stuff that any of you could go out and look at quite easily. So take-home messages for those that like a nice neat ending. And essentially the take-home message, I think, is that if you put together an acupuncture package based on the effectiveness evidence, the safety profile, the fact that it can not just treat one specific symptom, but it can address clusters of symptoms simultaneously, which is obviously a big deal for something like stroke, then I think you can make out a good case for acupuncture to be recommended. But as we saw earlier, there's obviously a lot more information giving education needed for patients, carers, medical professionals, and of course for us too. Right, thank you very much for listening. That's the end of my talk, and I'm going to stop sharing and pass you back to Aram.
Thank you, Mark. Wonderful summary. Just to let everyone know, a lot of the information that Mark has kind of picked through that jumble of research is now available as additional infographics for you. I'm going to share my screen again and share a few of them with you. If we, let's see, where is it? We have created, for example, an infographic that talks about the tongues, master tongues specific zone-based points. Again, I want to shout out to Dr. Gill for his contribution on this. And these are available. They're nice synapses of each of the point and their application in CVA stroke rehabilitation. And with the work that Mark has done, we have a similar infographic for you on the stroke indications for somatic points. They're the combination points from various research papers, and it's summarized here. So you can look at their protocols and their applications. And these are like quick toolkits for you that you can have. I always consider them a must-have for your clinical practice and also for educational purposes. You know, you combine these packets together and you can create your own custom messaging for whichever region or whichever target audience you're addressing, whether it's a hospital, a hospice, a long-term care center, an ideal potential business opportunities for growing your clinic and clinical practice is to reach out to these long-term care centers. They're always looking for cost-effective therapeutic approaches for a lot of their in-house patients that are on long-term rehab protocols. Okay, Now, what I'd like to do is to finish the presentation with a simple case report from my personal experiences. And, this is an interesting application of looking at neuroplasticity, combining it and creating a new way of treating stroke, specifically in younger individuals, and combining game therapy. You may have heard of game therapy. It's gaining popularity, and I wanted to kind of put together a little case report of one of my patients that has produced some interesting results. So just to start with, this is a male, 26, with a left hemisphere hemorrhagic stroke in the fall of 2021. He was treated in a local hospital with surgical intervention and subsequent anticoagulants and recommended PT and discharged to home care for basically in the beginning was less than ambulatory. His tongue illustrations or photos are right here. You can clearly see the phlegm buildup and also the deviation of the tongue. I've shown the undertongue veins to indicate the stagnation of blood still. The left pulse was wiry and the right pulse was choppy upon examination. The summer of 2022 is when the patient actually presented to our clinic with right-sided hemiparesis, clonus, and spasticity of both upper legs, upper extremities, and lower extremities on the right side. His treatment was acupuncture and electroacupuncture, TWINA and lifestyle modifications, and it was twice per week for 1 hour for 3 months course, and improvements were noted in both range of motion, motor control, muscle strength, nociception in both the upper and lower extremities. Well, of special interest is the integration of the neuroplasticity in game therapy, which I'll demonstrate in later slides, which really produced some remarkable outcomes. These are the pre-stroke hospital MRI images, which shows the hemorrhagic changes in the left hemisphere and the temporal region, producing the ischemic changes to the local tissues. Now, what is neuroplasticity and how do you work within it, right? I mean, this is a subject that is constantly being revised and reviewed, and surgeons to neurologists to therapists are integrating the concept of neuroplasticity into their practices. Well, according to the research cited there, use of rehabilitation techniques such as acupuncture, electroacupuncture, sensory input, and environmental adjustment improve morphological changes in neuronal synapses. How does that happen? It happens by engendering recruitment of supplementary ipsilateral pathways and generating a new cortical map. Now, when you have a ischemic event, a stroke, for example, it can have either a spontaneous recovery, like in TIAs, it can have a compensatory recovery, or through intervention, a recovery. The intervention really relies heavily on rehabilitation techniques used and the combination of that with the patient motivation. I found that the patient motivation really played a very important role in this particular case, because this individual was young and he was really adamant about getting his life back. Right? So the key here is to induce sensory input in order to engender this unmasking of latent synapses and neuronal and implement neuronal morphological changes. What are these morphological changes? Well, we'll see that they can be recruitment of supplementary and associated areas. They could be recruitment ipsilateral neuronal pathways, all of which really engender a change in the cortical map, and then providing and producing behavioral functional improvements in the patient. When you look at, for example, an exact example of this, you can see a rerouting morphological change or a sprouting morphological change that occurs during the neuroplastic event, right? This is a before illustration of pathways and after illustration where the primary pathway that is severed due to the stroke or due to the injury to that neuronal pathway, one of the secondary pathways steps up and becomes a rerouted primary pathway for that signaling mechanism. Sprouting is basically a situation where a neuron will sprout new axonal and dendrite extensions to provide the carrier mechanism for conducting the work that was the injured neuron was performing. So these are some of the foundational backgrounds of what morphological changes occur during neuroplasticity. So based on that concept, based on neuroplasticity and neurorehabilitation, there's an entire realm of industry that has sprung up. I have worked very closely with one industry, Exotech in Poland, which is basing their neurorehabilitation robotic devices on the concept of gaming. So they integrate gaming into a neuroplastic environment with neurorehabilitation modules. You can see examples of them here. And the concept of introducing gaming into the environment is to provide that sensory input, which changes and enhances the neuronal pathways. So back on that concept of neuroplasticity, the specific treatment protocol that was used in our clinic for this individual was basically a selection of points from the listed points here. I'm not going to list every single one of them, but you'll find similarities that Mark had actually mentioned in a lot of the research projects. Tai Chong, Hegu, Zhu San Li, Xuan Xiong, Yang Ling Chuan, Feng Long, and also opening the Yin Chao and the Yang Chao vessels and the Yin motility and Yang motility vessels. Of importance is also the integration of scalp area acupuncture, specifically the motor and sensory area lines, specifically with electroacupuncture on the contralateral side. TWINA and manual therapy was implemented only after the observation of reduction in the clonus and spasticity of the affected limbs. And TWINA was primarily used for as a adjunct, almost like a physical therapy alternative, to improve range of movement, promote muscle regeneration, and strengthen the local muscles. Beginning the 8th session, we integrated game therapy. And the game therapy basically consisted of an Xbox. I'm sorry for those of you who don't like Xbox and are PS4 fans, okay? But get one of those in your clinic and you'll see the benefits, specifically if you're working with neuroplasticity or younger individuals who may have muscular injuries or atrophy and you want to re-engender strength and build muscles, right? So these are some illustrations or some photos of the actual clinical setting where scalp acupuncture was done, either manual manipulation or electroacupuncture, while the patient was engaged and stimulated through a gaming session. This was a simple game. Any complex games would have probably added more stress to the environment. So simple games, right? Moving things, racing cars, building blocks, taking things from point A to point B, etc. You just want to engender that connection between the observational, the hand-eye coordination, if you will, and that really stimulates the morphological changes in the neuroplastic model. And the end result, one of the short videos, you can see this was the affected hand, and you can see already that he's fine motor controls in terms of commanding the controller for the game. And he's currently finished his session, and he'll be coming back for more muscle strengthening. And I've included some of the references for the research programs here. And if any of you are interested in looking at more specifically the case report or discussing it more with me, contact me directly at the email or reach out to the RTF group here. So that was it, a quick synopsis. So thank you very much, everyone, for joining us. I'm going to stop the share now and open this up for questions, comments, conversation. We're at your disposal. And again, thank you for joining us. Ben, you are our co-host.
Yes.
So
Yes, I can say that if anybody wants to speak, just open your mic and talk. If there starts to be too many questions, just raise your hand electronically and I will be calling your name.
awfully quiet.
Yes, I believe there are no questions.
Hello, do I need to raise my hand or directly to make comments?
No, go ahead, Tiangyun. Go ahead, sir.
Okay. Thank you for giving the opportunity to share some comments. First of all, I'm very pleased to see our acupuncture societies to raise the awareness about the acupuncture for stroke. As you know, as I think some of you have already noticed, in the Western countries, stroke is not a common problem in our acupuncture clinics. But in China, it is a very common. Many of you have already mentioned. But why? I have already published several papers in the Western countries, particularly in the British Acupuncture Council, the journal called ACU. I think at least 2 papers regarding for the acupuncture for stroke. One of the paper I mentioned, can acupuncture treat stroke? Maybe some of you still remember, I feel Mike still remember. In 1 year of the ARRC, the conference, the Professor Nick Robinson present research regarding for the a survey about acupuncture stroke. Many practitioners say, I never treat any stroke, or very rare. As Mark mentioned, in his 40 years, 40 experiences, but only 5 stroke patients. But why? Why? And I noticed Mike mentioned that one of the factor is education. This education is including education public, active patient, and education ourselves. Because for myself, I'm quite we say familiar with this area. Every year I treat more than 10 stroke patients. More than 10 stroke patients. Even now I have 2 patients in my clinic. But why? The reason is do we have sufficient knowledge about stroke? So I'm happy for several you have mentioned about the basic knowledge of stroke. And do we have a good skill to treating stroke? Some of you have mentioned, such as the Aaron mentioned about the stroke, the scalp acupuncture. How many of us know scalp acupuncture? So more than half of my patients are referred by other colleagues. That means when patient contacts them, they say, oh, I'm sorry, I don't know how to treat stroke. You may see Dr. Wang, you may see someone else. So I believe if we give us enough education on the basic knowledge about stroke and the skill how to treat stroke, then we are more confidently to accept the request for treating stroke and achieve the good clinical results. So that's my first comment. Thank you.
Thank you, sir. Very, very good. You raise a very important point, and that is the education. First and foremost, when you first go to a TCM school, I think any number of your teachers would probably approach you, especially if they were one of the older generations, and say, physician, heal yourself, right? We begin by looking at ourselves as physicians, right? So we address our own issues with our TCM. So I think given that, it behooves us to educate ourselves on what is stroke, first understanding the technique, and also creating a package. If this is something that you're interested in, you may not want to have anything to do with stroke, and that's fine. But if you're here, I venture a guess that you're at the very least curious and interested in expanding your knowledge, expanding your horizon. And this is why, like Dr. Wang said, there are schools, there are lectures, there are our group, the research task force, that will be constantly providing this information for you so that you can improve yourself, so that you can enhance your skills, learn these new techniques. Dr. Gill's master tongue points, the summary that Mark put together about somatic points, learning and understanding the concept of scalp acupuncture, and then putting a message together from your own. So thank you very much, sir. I appreciate it.
Thank you.
Any other questions?
So Aaron, can I just add a brief word in reply to Qianjun, which
Yes,
was
please.
just to say that that the survey research that we were referring to, and you were, Qianjun, that Nikki did, part of it was talking with stroke club leaders, representatives. Now, I've never, and they were interested. They were very happy to have acupuncturists come and talk at stroke clubs to their members. Now, I've never visited a stroke club. I don't know where the nearest stroke club is, but I think, if you were someone who wanted to start getting more into this area, then that one obvious thing would be to find out where these stroke clubs are and put yourself forward to go and give a talk.
Thank you. Gil, yes, go ahead.
Yeah, I may have the same voice as Mark. First of all, thank you very much, Dr. Wang, for your comments. Definitely skills and confidence are very, very much important in order to treat patients with stroke, because stroke is such a complex disorder. I think from my perspective, now I'm based in Amsterdam, living in Europe, but before I lived in Taiwan for 6 years and in Beijing, China for 1 year. And originally I'm coming from Israel, and specifically in Israel and also obviously in Asia, the level of integration is very impressive. So for example, I worked in Israel in one of the hospitals over there, and we had experience treating patients in the emergency room, in the ER room, with all kinds of injuries like whip flashes and all kinds of orthopedic associated pain. And that was because of initially some individuals who started to collaborate and work in the hospitals and develop integrated medicine departments, combining not only Chinese medicine, but mainly Chinese medicine and acupuncture with the Western world in the outpatient departments and also in the inpatient department. And I think because stroke is such a complex disorder and our treatment is very important, but it's part of the whole tools and whole treatments for the patients, which makes this treating those patients quite complex. And maybe one of us here in the audience are eager and motivated to develop more this area, and he should try to find ways to collaborate with the Western medicine, because the patients are there and we need to find ways to get inside the systems in each country individually. So I think this is one of the biggest challenges as well, besides the confidence and the skills that are very, very, very much important, as you mentioned.
Thank you, Gil. Sally, you have a question?
Yeah, a question and a kind of a comment, I guess, really. I'm a UK NHS physiotherapist, and I see stroke patients, other neurological conditions, Parkinson's, and people are talking about collaboration and integration, which I think is really, really important. So using things like Stroke Club or charitable organisations that see stroke patients. What's really difficult in, culturally, I think in the NHS is acupuncture, the way in is to see it as a complementary therapy, to see it as an adjunct to conventional medicine. And I think there's been a misperception maybe among my colleagues that acupuncture is trying to, do something that it's not really trying to do. We're just talking about symptom management, aren't we? And helping recovery and rehab. So yeah, I think there's lots of other organisations, both within the NHS and outside into the charity and third sector that we could look at integrating into. Certainly in the UK, I know we're talking to an international audience. I'm quite intimidated.
No need, Sally. Thank you. But again, I think this is one of those forums that will hopefully engender this cross-border communication, because after all, what we're trying to do is really promote the profession and the application of acupuncture in clinical settings. And as I mentioned earlier, I think one of the easiest low-hanging fruits, and this is one of the ways I integrated it in the United States, is working with long-term care centers. A lot of the long-term care centers in various countries, they have a completely different setup, and they're a completely different task, and their P&L levels and management levels are very different. In a hospital setting, there's a lot more tighter controls about what can be allowed in and out. In long-term care centers, a lot of it is patient prerogative. So if you have a really good educational program and you can really get your patients to advocate for you in long-term care, or your patients' care providers, their family, etc., can lobby for you, you can easily find a foothold in one of these long-term care centers and start providing services. And then from there, it just blossoms. Their rooms next to each other. If they see you coming in and giving acupuncture to one patient, all of a sudden 5 or 6 people are going to contact you and say, hey, what were you doing there? Can you do it for me as well? So find these low-hanging fruits, educate yourself, create a nice package, and then go out and reach for it. I think if we do the work initially, we will be accepted, because the evidence is there and it works. Acupuncture works, right? And that brings me up to the conversation that we had before. The year before was I do acupuncture. Right now it's acupuncture works. Right now, for next year's group is acupuncture saves money. So that's going to be our hashtag for next year. Start thinking along that line, everyone. Okay. Any other questions?
I'd like to just make a comment, because we talk about, my name's Laurie. And
hi, Laurie.
And I practice in Gibraltar, and there's only 3 of us practicing. My daughter, who's acupuncturist and Chinese herbal medicine, myself, an acupuncturist, and one other lady in Gibraltar. And when I was in the UK, I was back in the UK for 8 years. And I went to the Parkinson's associations and to the local groups, gave talks. And what really gave encouragement to the people living with Parkinson's was to say, well, you don't all have this one label of this disease of Parkinson's. The etiology is different for everyone. And so the Parkinson's associations, well, the local groups, paid for 12 weeks of treatment for all their members. Wow. And there was only one person who didn't continue with the acupuncture because he was quite angry. And but everyone else said how their quality of life improved. 2 people got out of wheelchairs, to walk with their frames again. It was. And I felt at that time that if the British Acupuncture Council, to try and speak to the associations, also the associations who are, taking the membership fees, instead of channeling it always into some sort of PR and plastic balloons for Acupuncture Awareness Week, were to put it into actually building a clinic, a complete Chinese medicine health center. Where people could come in for learning about food energetics, an organic cafe, Tai Chi, all the different therapies that we do. Because the proof is in the pudding. We know it works. We know it achieves wonderful things. I'm really busy in Gibraltar, but it's very difficult to have any kind of relationship with the health authority. And so I think, there's people like you, there's in Israel, the UK, Germany, everywhere. If we had a little group of sort of acupuncture ambassadors who would come to somewhere like Gibraltar and say, okay, we're going to be here for 1 week, 2 weeks, and people are welcome to come and try this. That doesn't mean I shouldn't train, do extra and more training in treating stroke. Because it's all come on, so far. But But I think that there's a way forward of being more proactive in that way, of having Chinese medicine health centers, and just doing that to show, to really prove what we do and that it works. And that way, maybe the local health authorities would then invite us in, say, well, go there because you understand what I'm saying. I'd be interested to know if that you think that would even be a viable idea.
Yes, I think, thank you, Laurie. Very poignant comments. I think, what you're seeing here in terms of this research task force's outreach program, our webinar programs, our educational outreach programs, the tools that we're putting together and trying to get it out to our community and our members and our membership is a step towards that. When you're dealing with the numbers of membership associations that we have and the differences in countries and cultures and time zones and all of these, it adds a level of complexity. But there are programs in motion right now from within ETCMA. You may have already been aware of the new announcement that came out just immediately after yesterday's news on the November 16th from our president called One Voice Big Evidence announcement. If not, please be sure to view that. It's on our YouTube channel. And it announces a global initiative on integrating and providing additional integration and cohesive mechanisms to provide these types of tools, right? Outreach in education, not just education for us as practitioners, but education for the John Q public, right? And that includes all the stakeholders, from the corner pharmacist to your neighbor, to the lobbyist in the government agency or the government representative who's going to make laws that regulate our profession. So programs are in the works to create advocacy campaigns. We already have an advocacy package from ETCMA that will give you the tools on how to talk to the lawmakers and what to present to them. And your ideas of setting up these ambassadorship programs is an exceptional idea. And, we have been looking at creating some sort of a network. Pretty soon, starting next year, I think you may see that ETCMA will have a direct outreach to all of you individually and allowing you to become a a representative, if you will, of this ambassador program. These are all in the works. So I appreciate you calling us on that, and it's coming. Just a little patience, please. We've got a lot on our plates, but I think we've made some progress, and we're going to be making more progress.
Right.
So thank you.
And I never been in Gibraltar, so
there you go. Here's your first visitor right there.
I will keep your invitation to come over there.
Great. And I think Mark is going to be second.
Yeah, I'd love to.
It's still very warm. People are still swimming.
Thank you, Lord.
We have a question from Fabienne.
Hello. I'm not familiar with scalp points. I imagine there are groups of points that are different to the do channel and gallbladder and bladder channel passing over the head. Do you find they're quite indispensable to use when you treat patients who had strokes?
I'll take it, and then Gil, you go for it, because I know you're chomping at the bit. I learned the scalp and the various scalp points in China when I was doing my residency in the Sichuan Academy, and I think the application goes well beyond just stroke. I have integrated scalp point in various other treatments, Parkinson's and neurological pathologies, any number of musculoskeletal pathologies. It is a standard application or a standard set of tools that I include in almost a good percentage of my therapeutic treatment. So, it would be a good exercise for you, Fabienne, to at the very least learn about them and maybe find ways to integrate it into your practice. It's not just for stroke.
Okay.
And ETCMA has tools available for you. I think we have an infographic on just like the somatic point on scalp points.
Okay,
and,
because that would be my second question: what's the best way to learn about those scalp points?
Excellent. Reach out to us, and I'm sure I see a wonderful background of London Academy of Chinese Acupuncture. I'm sure Dr. Wang will be more than happy to provide you with the information.
Okay.
There are schools that offer continuing education programs. Reach out.
Okay. Thank you.
Just by this chance, I make the little comment on here. I am already invited for the ETCMA on the next Luxembourg conference to teach scalp acupuncture. So you are more than welcome to join the congress on the Luxembourg to join the course, the 2-day course. After the course, definitely you will be more confidently to treat many neurological diseases, including stroke. Thank you.
Okay, thank you.
There is a question in the chat, and I think this will be for everyone. The person was asking, where can we download the resources you mentioned? So Aram, I think a lot of people will want to know that, and if you can show that again, or how to get there.
Yeah. Hang on. I need to share screen. And it is, all right, where's the drive?
I think it's also available in our Facebook page. So if you don't follow ETCMA, you should start following us. And the newsletter of recent autumn newsletter is there, I think, right?
Yes. All the newsletters are there. For those of you who are not subscribed, go to our website, etcma.org, and subscribe to the newsletter. It will allow you to get all of the updates on a regular basis. And if you are a member of one of our associations, then you will have access to all the files that we're talking about. If you just give me 1 second here, forgive me. All right, here we go. And where is it? Members Department. So if you are a member or a membership association, you have full access to the shared drive. You have already got a login ID and an access, and you can go into all of the specifics and look at your state, and you'll have access to, for example, if you're from a United Kingdom, you'll have the United Kingdom, the British Acupuncture Council. Because I'm not a member, it won't show, but all of the files will be listed here under your shared drive. Okay.
Yes, just to make.
That's what you wanted me to do, right, Ben?
Yes. The people that have access to this shared drive are usually the people that are part of the board of your specific country or specific association. So they can get it for you. If you can ask them, and they have direct access to it. I believe that in the newsletter there will also be a link to these different ones when it comes out, and this will be a link that everybody can access.
Yeah, to a direct download. And as I said earlier, if you're not a member of one of our associations, or if you want to get a direct access to these information, reach out. Georgette, our secretary, just posted an email. Reach out to us, contact us, and we'll be more than happy to share our information for you. Okay.
Okay, everyone. Thank you very much for participating. Have a lovely evening. For those, for me, it's already 10 o'clock. So
Excuse me, Ben. I think Fabienne has a question.
Fabienne still has her hand up, I think, from before.
Oh, okay. All right.
But I just saw a hand go up, but then the camera went, okay. So I think it was a goodbye. So thank you, everyone.
It was a goodbye.
It was a goodbye.
Yeah. Let me just close again in thanking every single one of you for taking the time and participating on this call. please share and promote our profession at every opportunity you get. You are, I think Lori was talking about ambassadorship. Well, guess what? Every single one of you here is an ambassador by the simple fact that you've chosen a career, a path that is off the beaten path, that is hard to walk, but is so rewarding on so many levels, makes you an ambassador of this profession. The messages you take to your patients, to your neighbors, to the local doctors, to the pharmacy, every time you speak, you are our ambassador. So I thank you for your job, and I urge you to promote. Share the videos, share the I Do Acupuncture. We have a website for you, idoacupuncture.com. Go there. Send us a snapshot. We are creating a global map of the world, and I want videos from every one of you that says I do acupuncture in your own language, and send me the city you're in, and we'll put a little tick on that map. And I want that map to be so populated as to, you have to really zoom in to find yourself. And every single one of those will then be another ambassador for us. So I encourage you to be confident, I would even say be cocky. Our profession has stood the test of time. Don't be shy. Don't be gun shy. Be proud of your profession. It works, and it should be considered a mainstream part of an integrated healthcare system in the world. Thank you very much. Have a wonderful evening. Thank you.
Bye-bye.
Bye-bye.
Bye, everyone.